Hello from the Heartland. My name is Jenna, and this is SmartHER News. News when it matters and why it matters. Our SmartHER series features unique people who help us think and live smarter. Dr. Reinhold, what do you think has been the most significant impact of this last year on our collective mental health?
I would truly have to say the fear component of everything. I think it started with fear of shortage, with actual resources like the toilet paper shortage and, all the paper goods shortage. But I think it became now fear of the virus. So like it became health fears. It became fear of what people think of me, fear of, professional backlash, legal backlash. I think there's been and obviously, I mean, you've reported on not just the pandemic, but there's been a lot of really sensitive current events over the last year. And I think with all of those, it has just brought a lot of pressure to collective social environment, just even in conversation with people. I never would have had fear of even going to a party before this past year, like so or fear of going out and how do I act with people? Is it okay to shake hands? Is it not okay to shake hands? Is it okay to hug somebody? Is it not okay? Do I wear a mask to this function? Do I not wear a mask? There's about 1,000 micro decisions that we're making that this pandemic has added. And I really think it's based in this really undercurrent of fear.
All of what you just said resonates so deeply, which is why I wanted to have this conversation. It's the little things that take so much mental energy that's just piling up. And I woke up the other day and I thought, we have now been really in this state, however we want to describe it, for a year. And I did write down, it's not just the pandemic, it's politics. It's a conversation
Mhm.
about race in America. We've had all these huge news stories that on any given year would be a top news item. They've all happened at the same
Mhm.
time. So I'm really excited to have this conversation with you. So I want to give you a proper introduction. Dr. Stefani Reinhold is a board certified psychiatrist, medical degree at University of Texas Health Sciences Center at San Antonio. She got her medical degree and master's of public health at the same time, which is perfect for this conversation. She then went to Washington, D.C., and did her adult psychiatry residency at George Washington University Hospital. And that gave you exposure to inpatient, outpatient. I didn't really know a lot about this until we talked before, but talk to us a little bit about how just your background has given you a little bit of context, a lens to view the current state of mental health in America.
Well, Washington, D.C. was such a cool place to train because I not only got actually the public health component, I actually did research at the CDC branch out of Washington, D.C., but also throughout my psychiatry training, I treated everyone from just homeless, addiction on the streets to very wealthy senators and politicians and college kids and everybody in between. And it's a very culturally diverse, ethnically diverse, socioeconomic diverse city to be in. And so, for me, I was a military wife. My husband was active duty Army. So he was getting stationed there. And by the grace of God, I got accepted to a residency position there. But little did I know it would really inform a certain depth and breadth to my practice, now years later, because I think we're seeing a lot of those same divisions now, not just citywide. I think with social media kind of infiltrating all of our world, it's now happening at our doorstep, because it's on our phones. And so it's not necessarily that all of these big hotspot cities in America are the, cultural melting pots. It's now happening on our phones and in our backyards. And I think even, the suburb that we live in, it's become more and more diverse and even politically, ideologically diverse than I think we ever expected. So that it is really interesting that my background kind of shows what's now going on in the world too.
And now you have a private practice where you see people on a regular basis?
I do. Yeah, I have a private practice outside Austin, Texas, and I see everybody from kid. I am not child and adolescent board certified. However, because there is such a shortage usually of those providers, I do have training to see adolescents definitely, and then case by case, depending on the child, I'll see sometimes younger children, but up through geriatric patients. Um,
And why did you want to become a doctor in the first place? Where did that pull come from?
Yeah. So I grew up in North Texas town, and I don't know, probably like most typical American families, if you tend to be a smart student, your parents are like, "Oh, you should be a doctor. They make a lot of money." And so my mom was a nurse, and she knew that my personality type she didn't think was a good fit for nursing. Probably because I'm a little bit of a control freak and a little bit dominant personality type. So she pushed me in the medical direction because I liked math, I liked science. School was always fairly easy for me. And so I went through, I did my training. I actually had no interest in psychiatry. I didn't know what it was. I thought it was weird. Um, I just, it wasn't, it was sort of the black sheep of medicine, and frankly kind of still is. And we can talk about that. I think it's that way because we just don't understand it, and in medical school, we actually used to call our psychiatry rotation our psycation because it tends to be a little bit less of the hard science and, more of the humanitarian kind of soft science. So meaning for a typical good student, you tend to do a little bit better academically in that subject. But little did I know, I actually did a rotation when I was in San Antonio at our veteran affairs. And that was where I was put for psychiatry. And my husband was active duty at the time. And I don't know, I really had a heart for that population. I remember always really loving my psychiatry rotation. I just thought you get such a deep connection to the people that you treat. And it was exactly why I wanted to be a doctor and not, say, an engineer or a businesswoman. I really wanted to, I know it sounds cliche, I really wanted to help people. And I really saw that as the field of medicine was going to big medicine, I'll say, to where you have to see more and more patients a day, you have, less and less reimbursement, just a lot of the systemic issues of our modern medical system. I saw that psychiatry really was the last field of medicine that you had time with your patient and also a depth of connection with your patient. And so kind of on a whim, pretty much an act of faith, I was like, I think I'll do psychiatry. And I got to say, everyone in my family, including my husband, was not particularly supportive of that decision.
Really?
Uh,
Why?
I think, frankly, I think because mental health scares people. And I think people have a once flew over the cuckoo's nest view of
Sure.
psychiatry. And I think modern psychiatry hasn't branded itself good enough. That's what I think. I
Well, these
think
are
we have,
And these are all really great things to talk about because we're seeing
yeah.
that in the coverage of when we're talking about health overall, in the coverage of how we're even approaching the pandemic. I just want to clarify one thing. You didn't meet your husband on your rotation at the Veterans Affair.
No,
I
no.
just thought that was important. Or it's the side of the
That's
story that
great.
maybe we needed. Just wanted to get the timeline correct. Well, it's interesting. So this
Uh,
has been a topic I've really wanted to talk a lot about. And I don't know what I've been waiting for, right? That one study that's really going to underscore in the data just how tough this has been, or, some sort of flashy headline, something, in this period of reporting over the last year, it's been difficult because you want to double and triple source information that you actually can't. And yet here's a topic we can quintuple source, or if that's actually a word, you can ask a stranger, a friend, an acquaintance, anybody, if they have felt the effects of the last year on their mental health to varying degrees. And most people will say yes. And yet it's
mhm.
not something we're talking about at all as we're telling the story of our lives in the news. Why do you think that is?
Well, I want to back up just slightly because I feel like the reason we don't have that crystal clear study that comes out or
Yes.
that hallmark thing, I will say, because I think, first of all, the vast majority of people who struggle with any sort of mental health issue are not seeking services.
Mhm.
It's not like we go for our checkup to the pediatrician every year. It's not like we're going for a mammogram or colonoscopy or, there's no, I mean, some jobs require some kind of psych evaluation at some level, but the vast majority of people are not routinely seeking mental health services. It's not part of preventive care. Like, frankly, in my opinion, I think it should be in our country, but it just isn't, and I think for a variety of reasons. Some of it's cultural, some of it's just the stigma that's still unfortunately attached to mental health. But I think we'll never really get very good studies, frankly. And so I think that's why it is hard, even as someone who advocates for this and tries to educate even my own patients, especially the people that really want the numbers, they really want the facts and the data, which is definitely what you do as well. And I love that. But I just think you're never going to fully get that from mental health. I like to come back to, hey, have you talked to your mom friends? Have you talked to your family members? I'm pretty sure we're all struggling on some level, And I think that should be the proof maybe that we're searching for, is that those people in our inner circles are struggling. That means probably people in every inner circle is struggling.
What have you confronted when you talk about people struggling in your own practice? What can you tell us about what you've noticed about this particular time period and helping people with mental health overall that's different than other time periods where you've practiced?
That's a really interesting question. And it's, if I look at kind of the trajectory of the past year, it's been really fascinating because, frankly, so in March, like every other, amazing citizen of the world, I shut things down. I came home with my family, I went 100% virtual, and I actually saw a dip in my practice. And I remember thinking that was odd because I worked with, when I was in DC and different, occupations I've worked with trauma population. And I remember from the beginning, me and my colleagues who are very trauma informed from the beginning, we were like, this is traumatic. This is traumatic. Everyone should be getting help, But I forgot about a missing link, that in the state of a trauma, so basically in the middle of trauma, people do suppress their mental health needs. And that's for survival, right? I mean, if you imagine, like a frontline soldier, they're obviously not talking about thoughts and feelings. They're defending their literal basic needs and livelihood. So that's important. And I think I saw that in my practice. I saw really through about mid-May. So for about a 2-month period, this kind of mid-March to mid-May, I saw a dip of people seeking mental health services. And that was across the board. It wasn't just outpatient where my practice is, but it was my colleagues in the hospital setting. So people weren't going to the hospital. And that was maybe for lots of reasons too. People didn't want to go to the hospital, didn't want to overburden the system, what have you. But they weren't seeking any higher level of care either. And then what I saw is from about mid-May until current. So really the last, almost year now, but definitely the last 9-10 months has just been a continual surge. And it's been everything from marital issues, which is probably the most, I say minor, although that's serious too, but relationship difficulties. I've seen really severe depression. I've seen a ton of anxiety. Every kind of anxiety under the sun. I've seen OCD symptoms. I've seen really children, adolescents, and I've seen somewhat bizarre symptoms too. Bizarre meaning I've actually seen a really spike in adolescents with somewhat derealization symptoms, like they feel like they're living in a dream or they feel like this isn't real. And I can talk about why I think that is, but that's been a really interesting symptom that I've seen come up really since school started. I see adults who just have chronic fatigue and their primary care doctors don't know what to do with them. And substance use issues that have just skyrocketed. So it's been a really heavy season of work for myself.
Well, one of the things that you mentioned to me as we were preparing for this interview, we did a pre-interview conversation to try to get a handle on a couple of points that I think are really important for our audience. One of the things that really stood out to me is you said that often, in general, you're taught as a psychiatrist, and you can speak to this better than I am. You're going to talk to someone after trauma, they've gotten past the trauma, and now you're going to help them. But that in this case, you find that we're still very much in the middle of trauma, and that's different. Can you tell us how?
Yeah. And I think, trauma is one of those things I say, it doesn't depend on the event. It depends on your perception of the event. So if you say are in a part of the world or even a part of the country that's been fully opened up and your business hasn't been affected and your kids haven't been affected, maybe you're not living in a state of trauma, and maybe you just have some general run-of-the-mill anxiety, or maybe you're doing perfectly fine and great, And then there's parts of the country, as you're aware, that are really still on lockdown, and it's a very different quality of life, and people who have lost businesses or people who have indeed lost life of loved ones, throughout all of this. And so everyone's traumatic experience is going to be different based on their own lived experience, and also even their prior history of a trauma completely unrelated to the pandemic. So all of that goes into what even that means for somebody. So I think, kind of where we're at in the country, I would say we're probably better than average, although still there's a lot of ongoing regular, how do I say, change to your routine than say from 2019. And so I do think that that could be still prompting trauma in some people if you are feeling that way. And so in that sense, as we're discussing, like how do I treat somebody when they're in the middle of this? I don't know. I wasn't trained in that. We were trained, on how to predict PTSD. We were trained in how to, help prevent PTSD even like right after a trauma. There's even certain blood tests that you can get in the ER after a traumatic episode that can predict the individuals that will likely go on to have full-blown PTSD diagnoses. But we don't have an endpoint yet. So it's not even worth ordering tests like that or evaluating somebody. So my job then becomes more of a supportive role rather than a curative role, which becomes then frustrating for healthcare providers, where we want to solve someone's problem, right? I mean, doctors were all maybe slightly narcissistic. We all want to save the day, right? That's why we entered the field we did. And so when people come to me and they still have struggles and stressors in their life, and I can't really do anything to change that because it's all directed around the environmental stressors, it's very difficult to do my job.
Difficult for everyone, right? And if you want to talk about narcissism, broadcast news, I bet pretty much rivals there. So that's good. It's a good admission, of that. I thought this was right after we spoke. We're talking about not having a lot of data. The CDC actually came out with a study on symptoms of anxiety or depressive disorder and use of mental health care among adults. And I just want to underscore this for our audience that, as you were mentioning, a lot of the studies are based on surveys, like people participating in a survey and sort of measuring themselves of how they're feeling. And so, depending on whether or not you're a person to fill out a survey or not, you may not be included in this slice that they're trying to extrapolate on. But one thing did come up that was very consistent in what you've been talking about, and I'd like you to talk a little bit more about what's happening with adolescents, is that in this study, it said that really the marked increases, first of all, was across the board, by the way, anxiety, stress, depressive disorder across the board, not really divided by race, not necessarily really divided by age, unless you were over 80, but who knows, maybe that's a survey issue, but that they were saying the largest increases were amongst adults aged 18 to 29 years old. That was a really interesting age group, because you think of that age group as optimistic, maybe resilient, I mean, you can pay me to go back to my early 20s, but it may not be exactly what I would have thought of, but you're seeing that in the adolescents too. So can you talk to us a little bit about what you are seeing with, what did you call it? Derealization. Yeah. What is that?
So there's different schools of thought on sort of what causes it. The most maybe consistent or overarching general thought is that it has to do with trauma. So, that's kind of the missing link throughout all of it. I think the elephant in the room is the mask wearing as well. And I do think that a lot of my students, specifically high school, college, who have to wear a mask all day, they are the ones that have had a lot of these symptoms. And I think it obviously stands to reason, regardless if you're for masks, against masks, that not seeing facial expressions all day does something to our brain, and I don't think that's rocket science, but I think it stands to reason that we should say that out loud to bring that to your awareness, because it does actually change the wiring in your brain, quite literally. And derealization prior to this past year, I had only seen in maybe a handful of patients ever. And these were all very highly traumatized individuals. And the fact that I kept seeing it very consistently in this population of people, and I would ask a lot of questions, was there a more overt trauma, other than the pandemic that did happen? No. Was this a family that was a very chaotic family, or there was other dysfunctions in the home? No. well, what else was going on in these individuals' lives? And really, there was nothing else to describe it other than a lot of the regulations and policies around the pandemic. And so when I brought it up to them, and it was really interesting to see that some of them started to have improvement in those symptoms, just even talking about, oh yeah, it could be the mask. It could be the fact that I didn't have a birthday party this year. It could be the fact that I can't do any of my classes, in person right now, or, just these very simple yet profoundly human behaviors that we have been denied really this past year. And I think this is where this ongoing state of trauma is, and why I think it does make us all feel really uncomfortable and anxious. And this anxiety piece, I think, coming full circle even to a few minutes ago, all of these questions that we're asking ourselves and these ruminations we're having. And, I remember so my daughter's birthday is in April, and that birthday party, because we were still kind of in our shutdown, didn't know what was going on in the world. That birthday was a wash. And then my son's birthday is in the summer though. And by the summertime, my family, we felt more confident to do some more other behaviors. But I got a really interesting backlash when I tried to have a little birthday party for my son. And again, it just becomes almost this bizarre, oh no, did I offend this person now? I mean, these are really good friends of mine. Do I apologize? I mean, do I just not have a party at all? Do I let my son down and then my son's sad? And then, it's just so many questions. And you would think that things would get better as the year has gone by. But there are a lot of us that are still kind of living in this very anxious prone place, which really is just our mind working on overdrive.
Interesting. I want to ask you about that because we tend to use the term anxiety a lot in, casual. And I wonder how we were able to navigate what's, I don't even know if I should say this because we don't really know, like you said, the end of this, right? Oh, well, this is just in the moment in time. I'm going to work through this. I'm going to kind of pass through this stage, this cycle that we're in. I think mothers are very aware of that too. You're like, okay, this is a bad stage. If I just wait it out, it's going to clear up. And it usually does. It always feels like it's longer than you'd hope, but it does. So I want to ask you a little bit about that, but I do have a question that is a tough one. And that's a question of trade-off. Right? Schools are a great example of that. There are those that say you have to have these kids masks, otherwise they can't go to school. And that's actually worse. But then there's a question of, well, if there's an anxiety that's attached to this new way of schooling, what's the trade-off, right? Of their physical health versus their mental health. And how do you weigh those two things when it comes to actual policy? I mean, that's been the tension that we've seen all along, hasn't it? Right? If I go into the grocery store without a mask on, what is my risk with my risk to my community? What's the trade-off? What am I trying to do? How do we even have smart conversations about that now that we're at this place where we have a year of experience and can start, making some decisions based on our community that might look different than the last year?
Well, frankly, I feel like we can't answer that question without addressing just the censorship that's happened in the medical community at large. It's happened with lots of news sources, but I think that is this unspoken current that has bred a lot of distrust, I think, in the general population.
You mean you can't even raise your hand and say, I'm still not 100% sure on masks.
Yeah.
Like if you do that, and right? Is that what you're talking? And that's what I'm imagining that kind of you're speaking about.
Or I'm talking about the studies that have, come out that have showed more favorable results in unmasked populations. And yet somehow they're flagged by every social media, or, they're hidden in search engines. And so if you can't have a free flow of information from all sides, we can't be able to individually or collectively make educated, informed consent. Informed consent is something that we do as doctors all the time. If I'm going to start, say, a prescription medication, I tell the patient risks, I tell the patient benefits, I tell them common side effects. And with the patient, we make a decision if this is worth it to them. A lot of times it is, because the risk of not having the medication outweighs, or I should say, the benefits from the medication outweigh the risks of not having the medicine. And any sort of side effects of the medicine are likely minimal to the overall benefit. Now, I think when we're talking about informed consent, that has been the biggest thing that's just been left out because, there are some studies that may say masks could cause like, bacteria infection or skin or acne, but those truly, I think that's less of the issue as the mental health harm that is on the other side that we're not talking about. What is the harm associated with, say, a baby that goes to daycare, that their daycare workers wear a mask all day, every day, and they're not seeing facial expressions for their first year of life? That to me is a very, very big harm that I would personally not put my baby in that kind of situation. But hey, for another adult, maybe they don't see that same harm. And that's their right as an informed adult to make that decision for their child. What's happened now is they've made these mass mandates for, I say mass, MASS, not mask, but mask mandates for schools and for businesses. And, we as, the people, we haven't had a choice. And there doesn't seem to be, from top down communications at least, that there was ever a consideration for mental health. When we had talked on the phone before this video, I had mentioned there was never a mental health professional on the White House COVID task force from the very beginning. And in our state of Texas and many states, there's not a mental health professional on a COVID task force for the state. And in most local governments and even school districts, there's not mental health professionals. So we're not seeing this very large piece of the puzzle to bring this voice that, hey, maybe there's some harms that we're not considering. So I think we can't even answer the question about trade-offs until we even know what those trade-offs are and we're having those conversations.
So it's really interesting to note that you felt that though you have felt censorship, or that it is have talked to us a little bit about that. Have you felt that you can't speak out on these issues as clearly as you want to? Do you feel like that's puts you at risk for whether it's social media or for your own practice, or how are you even navigating that as a healthcare professional?
Well, absolutely. I mean, I think it was about September when our school district went back to in-person school. And I remember all I did, I put up on my Instagram stories, I put up a question. I had a picture of kids in masks, or no, kids in face shields, not even mask. And I think I said, how is this how is this normal or something? Because for me, it was a little jarring seeing children in masks. And it was a little jarring reading that, school policy was to wear masks for 7-8 hours a day. If you take the bus, if you're in extracurricular activities, it's like an extra hour even by on the school day, they're wearing masks outside. And so I even just posed that question. And I got so attacked, Jenna. I mean, I lost followers. I think I've been censored from algorithms now. And that was from one conversation on Instagram. So I stayed out of it, frankly, because that experience was a little traumatic for me. But I've seen in my colleagues and friends from other states, and even just obviously people have had, their licenses threatened by prescribing, medications that are deemed a little controversial, or for having difference of opinion, like we're discussing. And so I think there's just not this free flow of information anymore. You're immediately deemed as this, you're promoting harm, and, you want to kill teachers if you're even question, hey, maybe this doesn't sit well with me to put a mask on my child for all day, every day. And so I think that's a problem when we can't have a conversation about these issues at large. Like the conversation is completely shut down.
It's actually great to to just hear from you, to hear that perspective, because even when you float the term censorship, or you talk about conversations being shut down, even that gets into territory where, like, well, is there how do we have this responsibly? How do I responsibly cover that topic? Because it is in that area of, like, we're all searching for the facts, right? Where's the proof? Where's the evidence? Where's the facts? Who can I trust? After you mentioned the mental health care professional not on the COVID task force, I went back and looked, because I know there was one, I've watched every single press conference at like hours of my life that I'll never get back, but that maybe there was a touch on that. But I wanted to see, like, what is there no one there? And no, not in the Trump administration, not in the Biden administration as well. Is there that person that's talking specifically about mental health? There may be people with some sort of a background, but not in the way that we're discussing it. So for people that are feeling the pressure of this time period, one of the things that you talked about is it COVID syndrome? Doctor, where you were saying
I
any number of symptoms are coming up. How do people even navigate what's I don't want to say what's normal. I mean, we can't even use the term normal. What's normal? I have no idea what's normal. How to feel themselves, during this period, and how to know, okay, this is anxiety that is because of the situation I'm in. But I don't feel that I have an anxiety. I don't know if I should use the term disorder, or I have anxiety in a way that I actually need to pursue help. How do we get the tools to even figure that out?
I think you first ask yourself, before COVID, even if undiagnosed, do you think you struggled with some of these similar things? That's usually the first question I ask. Have you ever struggled with anything similar like this in the past? And I would say probably more times than not, a lot of people have. I'd say most people I'm seeing, this may be the first time they've ever entered mental health services, but it may not be the first time they've ever had symptoms. And it just means that right now, hey, you're too overwhelmed, likely from stressors of the pandemic, complicating things further, but it doesn't mean this came out of the blue. I would say if these are completely new symptoms just in the last year, now that's a little bit more gray conversation. Is this lasting? Is this all day, every day for the last week, the last several weeks? That's more concerning than say, hey, I just have kind of 3 or 4 bad days out of a month. That's a little different. I would say probably every human being, pandemic or not, the goal is never to be happy, happy, joy, joy 24/7, right? I mean, even my goal for you as a psychiatrist is not to take away human expression, right? I think depressed feelings can be normal given any sort of situation. I think sadness is an okay feeling. I think when depression turns into days, weeks, even months for some people before they get help, that's when it gets a little more concerning. So one is history and one is sort of the time. And the third is, how severe is it? How much is it affecting your quality of life? Are you still able to show up for your family, show up for your job, take care of your own self? Meaning, are you able to bathe and wash your hair and get out of the house when you need to? And, I know we kind of laugh about these things, but there are patients that I see that literally are paralyzed by some of their symptoms, that they cannot leave their house, and obviously that would be something I would want to take to a professional, and I say that with absolute love, no judgment, that you're not alone, that these are things that people are going through right now. But
It's nice to
go ahead.
actually hear the spectrum, by the way, that it's okay to feel
Yeah.
sad or depressed or to go through a couple days like that. Because sometimes, at least I'll just speak personally, it feels self-indulgent to talk about mental health. Because listen, there's so many blessings that we all have. I mean, just living in the United States of America is one of them. Yes, things can be tense and very difficult, but we're very blessed. And so you always want to keep that perspective. But sometimes in giving that perspective, you're kind of devaluing maybe having like a tough time. And that's been personally difficult for me to try to figure that out, because this has been challenging, and it's been challenging for everybody. You have mentioned that there are some silver linings, including what you've seen as far as parents and their children. And I'd love you to talk a little bit more about that, and whether or not maybe that's something that you're seeing in other relationships in the household as well.
Yeah. Before I answer that, I did just want to add this one thing. I think a good gauge in terms of, is this self-indulgent, like you said,
Yeah.
or, is this something I should or can seek help for? Ask yourself this. If this was insulin for your diabetes that you knew would make you feel better, or if this was thyroid hormone for a thyroid disease, would you feel different? Would you not call it self-indulgence? Would you call it rather self-preservation and health promoting? And so I think, and that's going to be personal for each given person. Some of us, and there are, I'll say, There's a spectrum even amongst providers. And I tend to be kind of in the moderate ground, meaning some providers think every individual on the face of the planet should be in therapy all the time, which would be amazing, right? I understand that is not everyone's time and not everyone's resources. And frankly, not everyone actually benefits from therapy. There are people that don't. Then the other spectrum means really only if you are really serious and you have really severe symptoms, then you need help. And I tend to be somewhere in the middle. I do have some patients that are more on the preventive side, meaning they're healthy and well now, but they kind of come almost for like a checkup, more or less. And then I have patients that are actively struggling and actively in the state of, more of their symptoms that we're actively trying to treat. But I think you can think about it, hey, if this was anything else, because I want people to think of mental health not like a self-indulgence, like a facial or a massage or a pedicure, which are indeed 100% self-indulgent, also self-care, but more, we could probably live without those things if we had to, right?
And some of
Mental
us
health,
have over the last year. Yes, yeah. Yes. But I think you're correct in
yeah,
that the conversation about mental health sometimes goes into that area. Oh, it's
it
something that you
does.
can do when you can afford it. People that do it are the ones that have the time. They're the ones that are the social, certain profile. And we get, we stereotype the heck out of each other all the time.
Mhm.
So I can see that how it kind of gets into that area where it gets a little intertangled, maybe not in the best sense.
Yeah. But just ask yourself, if it was anything else, if this was, say, a mammogram I needed to get or some procedure that I know really would have a health promoting effect, would I think about this differently? Would I think about what I'm experiencing differently? Because there are really good relief that can come, and research actually shows that literally even one visit with a mental health provider will help correct a lot of symptoms. So I think it's also some lack of education that people think, oh, I need to be in therapy forever, or, oh, I need to be on medication forever, and that's the farthest thing from the truth. It's not uncommon. Sometimes in my practice, I'll see people for a one-off consultation, as a second opinion, even from their primary care provider or their OBGYN, or even only about 2 or 3 sessions. And then we kind of correct things.
It's
So
so
just wanted to
interesting
make,
because I don't think I've ever really thought about it that way. Thought about it like a commitment, it's going to be an 8-week course,
Mhm.
8 months, maybe 8 years, it's going to be
Yeah.
that. And one of the things that you've talked about in the past is how hope matters, that
Mhm.
hope is a really fundamental part of mental health and having hope on the horizon. How do you think that's impacted how we're all feeling? Because I know so many of us are kind of wondering, well, when do we get back to normal? But then there's that question about what does normal look like? And are we
Mhm.
ever going to be back there? And there's a grieving process with that, right? We don't
Yeah.
even know what's next. So is there a way that you keep hope in your life? That you somehow pull it into your family so that that's part of your care for your immediate group?
That's a really good question. I mean, I have hope through my faith in God. I'm a Christian, and that's obviously a huge part of how I can keep hope, frankly, especially in these times. We were talking a little bit off mic, but I've been through deployments, with my husband, and actually his most recent deployment, which was right before he separated from active duty only a couple of years ago, was a more traumatic deployment. He had a lot of loss of life of soldiers that he served with, and it was a more, obviously makes it traumatic for me. And I think you go through this very bizarre, I don't know if I'm going to see my husband again. I remember during that deployment, I actually found I guess he had hidden these letters that he wrote to me and the kids. And I don't even know why I'm bringing this up, but, he hid them, if anything were to happen to him and he wouldn't come home. And I remember I found them accidentally one day. And of course I read them because I'm nosy. um, and you just break, and you're like, you're praying, you're like calling out to God, like, oh my gosh, just please bring my husband home. Like, I don't care. Like, I don't care if he loses a leg, like, I just bring him home, like, just bring him home. Um, and you go through that and you see your husband come home, if you are blessed, and gosh, my heart goes out to all of our friends that have had loss of loved ones overseas, but you realize, like, that's the worst it's going to get, you know? I mean, we are so blessed and so privileged to be in the United States of America, which is still a free country. And that fear, I probably have more fear of losing loved ones than I do of my own death. And that level of fear you go through and you realize you can make it out, I think has prepared me for even this past year. And I know that sounds like probably a very silly analogy to many people, but you realize that I can be okay, and that there is hope. And so I hope that even this year becomes that for people, not that I want loss of life, not that I want our country to go through any more backlash, but I do think sometimes you go through these really awful traumatic experiences, like a pandemic, like a deployment, and you realize it couldn't be worse than this. It will get better. And it's like that rock bottom, like you just know that, at least for us, and again, I'm so privileged to be able to say, like, this probably is the worst that it will get. But whether you lost your business, whether you've lost loved ones, this is the worst that there is. Like, things will get better from here. And I think that's a really important message, because depending on where you stand on certain things, I think this past year has felt like things just are constantly getting worse, and it's getting worse, and it's getting worse, and it's getting worse. And that's how I felt when I was on deployment. I felt like things are getting worse. More people are dying. I haven't heard from my husband this week, like, what's going on? And then all of a sudden it's good. And I can't, if you've never been through something like this, you absolutely will not know what I'm saying. But like, the minute you see your loved one like coming home and you like touch them again, and you're just like, it's like giving, it's when you give birth to a baby and you don't know, like, the whole time you're pregnant, you're like, oh, I don't know, anything could happen. And then you like hold your baby and you're just like immediately washed with calm. And all of those fears of, loss of life or losing your freedom, or, all the fears of the pandemic, I do truly believe something is going to happen that will wash all of that away. And I think a belief in that, like having a really strong belief that things will get better, is in and of itself the hope.
Obviously, it resonates with me. I was getting choked up listening to you about your husband being deployed, because it's a very unique experience. And when they come back, there is that really, all that you described so well, Stephanie. You just that beautifully. And then when they come back, things do evolve, right?
Yeah.
There is the next chapter of the story, and it may not look exactly how you imagined, because everyone's changed, but the story still goes, right? And there are those amazing moments still ahead, and you have a different appreciation for those moments, having gone through what you've gone through in the past. So I too have tried to take the perspective, and it hasn't always worked, of thinking about this time period that somehow we've been chosen to confront all of what we're confronting. And again, it's not just health. It's not just health. It's politics. It's the economy. It's how we're, it's gender, it's race. I mean, if you think about all these pillars that we've confronted, and I think about that with our work at SmartHER News too, being chosen to provide a service during this time. And it could happen anytime, but we decided to do it now during a global pandemic, and so you have to just kind of go with that and think, okay, maybe indeed, maybe it is that we're chosen for this moment, and we have no idea what's ahead. And even though you can let your mind go to the darkness, you got to balance it. It's right. Because it's nonpartisan. We got to balance it with the light too. You got to do it at the same time. So talk to me about some of the silver linings, like parents being more in tune with their children, something that you really think is a product of this period that maybe would not have happened in the same way.
Yeah. Yeah, it was interesting because we were talking about this I have seen a huge surge in my practice of adolescents, of minors, of parents reaching out on behalf of their kids. And when I first saw that, I thought, oh, kids are just suffering galore, which I do think. I do think there is definitely that component, that I think this pandemic has been hard on adults, and we know that our adult stress trickles to our family. And then I think also that there are individual stressors on kids, specifically in schools, and just, the whole culture right now is just under a lot of it's like a pressure cooker right now, I feel like. And our kids take on that pressure. And so it comes out because they still have developing brains. So I do think they have been very vulnerable to a mental health attack. And I also think that maybe because of parents' own awareness of their own suffering, or just because they are spending more time with their kids and they're more awake to issues that their kids are going through, I think they are catching things a lot more as well. That likely in years or decades past, either, we were too busy kind of working our jobs, living our life until things got really bad with our kids. And then, oh no, like, what do we do? But I'm seeing a lot more parents that are just more aware of what is going on with their kids, which I think is a wonderful thing, and kids being able to be honest with their parents about, yeah, I'm struggling with an eating disorder. Or, yeah, I have been self-harming, or, and I have not seen that is actually a very new thing. When I did my child and adolescent rotations in the past, those two traits in particular, self-harm and eating disorder behaviors, there hasn't been a great study on how long they're sort of covert symptoms before they're overt symptoms, meaning till we know about them. But I would say, generally speaking, it's several years. They're usually at least a year, if not several years, before there is acknowledgement from a caretaker, a loved one, a teacher, a parent who's seeing something like that and getting them help. And that is a really amazing thing that parents, after one self-harm, they're getting their kid help, which is amazing. I know from my experience, that hasn't been typical in the past.
Interesting. So maybe being more in tune, a little bit more in tune. And we have spent a lot of time together. You can't always ignore it, but that's really an interesting part of all of this. And you wonder what's the long-term effect of that if you're able to get someone a little help when they need it at the beginning versus when it's a much greater or more evolved problem. I've kept you long enough, so I really appreciate this. Though I do have two final questions for you, and this is one is less about our mental health for ourselves, but also for our relationships, because so many relationships have been challenged by simple conversations like wearing a mask or vaccinations or coffee, like really, and you see that. And, our community at SmartHER News has grown, and we've all gotten to know each other a little bit more. I think people get comfortable and then they speak their minds more. And I think we're seeing that a lot in social media, but even in our comment sections, I'm noticing a little bit less of a, sense of empathy sometimes. And I'm wondering if that, because of this prolonged period of stress that we've all been under in different ways, do you have any practical advice about how to navigate some of those confrontational moments in a healthy way versus maybe something that's less healthy or, more destructive to a relationship?
I think we have to learn as a society, a community, to detach these personal beliefs from politics, spirituality, faith, values, morals. I think that is the problem, right? Because it now becomes not just, oh, I'll wear my mask, or, oh, I won't wear my mask. It becomes, you're an awful person and I'm a better person. We have got to stop that. And the best analogy I can give, and, men, sorry, you're not going to relate to this, but I know most of your audience is women anyway, but the best analogy I can relate to is around labor, delivery, feeding our babies, right? Some women opt for a very natural birth. They want full breastfeeding, and that is very, very important to them. And you talk to breastfeeding natural mamas, and that is like life or death. However, there is a mutual respect that they understand, hey, there are life and death reasons why a woman needs a C-section. And there are life and death reasons why a woman can't breastfeed, because there is a mutual respect that, hey, just because a woman got a C-section, she's not a horrible human being, right? And vice versa. A woman who opts for a elected C-section and never breastfeeding her baby at all, and somehow we've missed the mark now in our collective community. And I might get hate for this because I understand that the concept with masks is that you need enough people to wear masks for them to be fully effective. But again, I do question, where is even that information coming from? And can we respect each other as human beings, who have brains, who are smart, who can make their own decisions, which you, Jenna, do an amazing job, like empowering your audience that you don't dumb us down. You want to make us smarter. That's your whole goal. And that's amazing that you do trust your audience enough that we can go on rampage in your comment section. and
It's
and
okay.
I
I'm here
think
for you for whatever if you need that, it's okay. Yeah.
um but I even think that that's good, because I think that we shouldn't be so I don't really know how to even put into words like what I'm saying. It's just, I think we have just so quickly bought into this judgment of a whole person based on one person, like one trait or one opinion. And there's a word for this. And I actually challenge people. So there is something called schema, SCHEMA. And schema therapy is of the concept that basically we all have a lived life experience. We have a schema, meaning when I see, a man who looks like my husband, he's going to probably evoke certain kind of trusting feelings and emotions because he kind of naturally looks like my husband, um, like a child, we all want to protect our children because we all kind of naturally have an innate desire to like protect kids or whatnot. But it comes up in some of these things in how we are triggered, and it's not so much about, I don't think it's about a mask. I don't think it's about the pandemic half the time. I think it's about how someone is feeling triggered. And if that's reminding them of some triggering individual in their past, say they're reading a comment under your post and it makes it sound like their critical father growing up, and then they're going to react in a certain way because that's how their critical father used to speak to them. And then it's like, oh my gosh, this person just sounds like my dad. He's just awful. But it's all happening at an unconscious schema level. And so I went really deep on you guys, but that's the point though. We have to be able to separate that, hey, because of my lived experience, I am going to perceive things in my life right now a certain way. It doesn't mean that other people are awful. I think we have to be able to accept that every individual in this world right now is trying to do their best they can. And that level of just inherent respect and dignity that we can give to people without this, I'm going to say, like a little bit of self-righteousness that, we have the answers because I read this hour-and-a-half documentary and this is proof and this is fact. And now I need to share this with everybody so that they all know that this is proof and this is fact, rather than, hey, I saw this hour-and-a-half thing. That's an interesting perspective too. But I bet other people, they saw other hour-and-a-half things. There was a totally different perspective. So maybe that's where they're coming from too. And it does take a bit of effort, because obviously it's that built-in impulse that we just want to immediately attack somebody and defend our position. And, it becomes this kind of very emotional thing. And, I deal in thoughts and feelings all day. So that's not uncomfortable for me, but I do think it's okay to like simmer down a little bit and think, use our thoughts and just think, hey, they're not attacking me as a person. They may be questioning the idea or my belief that I'm bringing to the table, but this person doesn't know me, And, social media can complicate things for sure because it's this virtual reality that we all kind of all live in. But I say try to take as many relationships offline as possible. That also helps to deepen the conversations, because I have many solid in-person friendships that we completely disagree on about everything. But we have a mutual love and respect, and so we can live life and do life together,
It's nice to be reminded of that. I think what you're talking about is, and it's actually really interesting to learn about the schema. I mean, I think now I'm going to look a lot differently at some even the reactions that I see from time to time. But this idea of extending grace
You probably
to each
trigger
other.
people, Jenna. You
I
definitely
definitely,
trigger people.
100, let me tell you, I do. Yes. And actually all people, not just one group, just everyone at different times. And that's actually kind of where that badge of honor, although it can be heavy. It can be
They're
heavy.
not attacking you though. Just remember that.
Right. But you know what you're talking about, the grace for yourself, grace for other people. I know we're trying to cling on to things certainty during uncertain times. And so that expresses itself even for myself in strange ways, And I'm actually glad that you met. We haven't really talked to We've covered masking, mask policies. We're always very clear with people that there's a certain limitation to the research because we can't control certain parts of it. We're not putting someone in a room and blowing live, new coronavirus in their face at the same speed all the time to see what happens with it. We just don't have that data. But we also have strong, more anecdotal data that maybe shows a different point of view that does help people in certain scenarios. So it's okay. We're a part of a developing story. We don't have to have all the answers. In fact, that's not what journalism is about. It's actually just about the developing story and being honored to kind of tell that. So just a last final thought. I always like to ask people, what's that one thing you feel that has made you smarter, or something that you feel that you can share with other people that may make them smarter based on your experience? I'll just leave. That's just like a big open-ended question, and I know there's a lot of places to go over the last year with it, but what would you say? Is there one thing that really stands out to you?
I think it's kind of twofold. So I would say, it actually took me going through my psychiatry training. So the joke in the medical field, which is why psychiatry is kind of the black sheep, is that, the only people that go into psychiatry have psych issues. Well, my joke is that everyone has psych issues. That truly, and I mean that, I do laugh and I chuckle because I know it's uncomfortable to say something like that, but I had a supervisor once during my training, and his statement was, everyone is suicidal. And of course, he doesn't mean everyone wants to die or everyone's thinking of dying, but it does mean that everyone is a human. Everyone at given times, we all have depravity of being a human, and we all can have despair and hopelessness and worthlessness. And, whether or not it turns into something more severe where you really should be seeking professional help, that's a whole different story. But part of being a human is thinking about death, is having depression. And that lifted this massive burden of my perfectionism in that season of my life and gave me so much freedom to walk and live as an imperfect, maybe person who has mental health struggles a time or two, because we all do, which is huge. But then secondarily, to be able to identify the emotions you are experiencing without judgment. I grew up in very traditional Southern Texas home where I thought negative emotions like anger and sadness were just bad, and you had to slap a smile on your face and be kind of glossy and well prepared, for your life. And sure, there's a time and a place where you kind of suck it up and you put on a smiling face, especially with kids and with your family. But it is not wrong, and it doesn't make you a bad human being to have somewhat negative emotions. And so being able to fully identify your emotions without judgment is therapeutic in and of itself. Literally being able to even say the words, I am depressed, it activates a different part of your brain than the emotion center of your brain that is feeling depressed. Helps you move beyond a depressed feeling. So I know that sounds wild and I probably lost you, but even just
No, but I see what
saying,
you're saying. Is if you kind of it's acknowledgments
Mhm.
without judgment, and almost being able to, I don't want to say ride the wave, but
yeah,
in some sense, ride the wave, ride this part of the
yes,
story, right?
yeah, without the secondary, tertiary emotions of shame, blame, fear, all the things, because that's what we do, right? We judge our emotions, and that's the problem.
100%.
That makes all the problems, because that's what makes more anxiety, and that's the downward spiral. And so just being able to say, hey, this year it's really sucked. And that's okay. That doesn't make you a bad person. It's kind of sucked for a lot of us. I had one of my businesses that I've pretty much had to push pause on just for my own life circumstances this year. And that's okay. There's been a lot of people that have completely lost businesses, people that have lost family members. Like, it's okay to be able to just say out loud, wow, this really sucks. That doesn't mean you're focusing on the negative. That doesn't mean you're not thankful for what you do have. That doesn't mean anything about you as a person other than you're acknowledging the truth of the moment, which, hey, this exact moment in my life is not the best. And that's why I do think that better is coming, and that good things are in your future, and that there is always something to be hopeful for.
It's reassuring to hear it. It really is. It's reassuring to hear it and reassuring to hear that from you. I feel like there's so much that we can take from that and apply to our life immediately that hopefully helps lift the burden a little bit. So I think that's definitely made us smarter. If people want to be in touch with you, what's the best way to do that? Is that something that they can reach out if they like to talk more, or what's the best way just to be in your orbit?
Yeah, absolutely. I mean, they can connect directly through my website, StefaniReinholdMD.com, or find me on Instagram. That's probably my kind of biggest place, although I haven't been super active, but you can reach out to me there too, Stefani Reinhold MD. My name's spelled, Stephanie is like Gwen Stefani, and Reinhold is Reinold MD.
I like that. I like the Stephanie spelling. Well, it's good. I like it. I got through the whole, I think I called you Stephanie once in the interview, and I feel like it's with Dr. Reinhold because you worked for that degree, and Dr. always. Thank you. This has been so helpful. I really appreciate it. I think it's a much needed conversation, and I have about 1,000,001 questions from this point on. So I hope you'll come back, and maybe we can even take questions from our audience to kind of have a Q&A. I think that would be really fun. But thank you for the time, and thank you for making us smarter.
Thank you.
Quick, concise, nonpartisan, smarter news, a refuge from the storm. I'm Jenna. Thank you for choosing smarter.